My name is Nate. I am the communication specialist at UMFS, and I am thrilled to be joined today by two extraordinary champions from our Functional Family Therapy program at UMFS. We often refer to this program as FFT. With us today is Sarah. She's the program manager for FFT. She oversees the program from the UMFS Fredericksburg office. Also joining us is Danielle, an FFT clinician and supervisor. Who is this designed for? Where is this service available? And most importantly, how does functional family therapy work?
FFT is a short-term, highly effective intervention that works with youth and families over a 3 to 5 month period. Primarily, we're working with youth ages from 11 to 18, and these are youth who have some externalizing behavior. So maybe they're struggling with substance use or theft or truancy, or maybe have high family conflict filled with verbal or physical aggression. These kids might also be involved with different systems, so that might be child welfare or foster care, or even the Department of Juvenile Justice. It's a home-based service, so we work in the home with both the youth and the family. And it's really a strength-based model with the foundation of acceptance and respect. We focus on risk and protective factors and really targeting those to build change within the family. There's a big focus on building hope and a relational focus while decreasing conflict, and then teaching behavior change skills. So moving forward, they can make more functional and adaptive choices to remain safe and stable. In regards to location, we actually cover quite a broad area. So the program is based out of our Fredericksburg office, but we cover the greater Richmond area, the Northern Virginia area, certainly Fredericksburg, parts of Tidewater and Williamsburg. So it's a large coverage area, and we do that on purpose. So we've hired clinicians in all different areas of the state in order to bring this evidence-based model to different communities.
Can you please paint a picture of some of the challenges families are facing or the circumstances that might make them a good candidate to receive FFT services?
Underlying poverty, there may be some comorbidity. A lot of the children and families that we serve, there obviously is some criminal or drug involvement. So that's another thing that we address. There may be a history of betrayal, physical and or emotional challenges, some resentful behaviors and or actions, but a lot of high probability for future problems that we are trying to address using our evidence-based model.
Can you talk specifically about what an evidence-based model is and the importance of that?
You really focus on outcomes. So in order for a program or a model to be evidence-based, there's considerable research that has been done to show the effectiveness of this model, trying it with different types of youth in different settings with various needs. And so FFT is actually done internationally. It's been a model that's been done in many different countries and for decades, and it's proven to work. That if you follow the model, if you follow the curriculum, that you will work towards strong outcomes. For evidence-based for us, it means that we also get the benefit of an international consultant on FFT. So they are providing weekly supervision, case staffings. They come to our office every quarter and provide training and support. So there's a high focus on using our time with families well, really the quality of time spent in really ongoing continued education for our team to meet the varying and significant needs of the families we work with.
How do the outcomes of FFT compare to some of these other programs?
It is very specific to the unique challenges of the family that is being referred. The goal is to help the family function better. When you think about functional family therapy, we're not coming in with a magic wand and saying like, when we leave, everything's going to be perfect. But we're being very individualized to that family and their specific challenges. And everything as far as like the behavior change, which is our second phase of FFT, that is where we really focused on giving them the skills to be able to address some of the reoccurring problematic behaviors, and then using all of the information that we come to really give them their own treatment plan, so to speak, that is tailored for that family. And then, like I said earlier, it is an evidence-based model that we're following that allows us to really get in and work with some of the challenges that these families are facing.
Can you please talk about the investment that you and your team make in the families you serve?
I think that my team does a wonderful job of really engaging the family. Some of them aren't as or in other words, they are very maybe reluctant for services, which, the fear of the unknown, you have someone that's kind of coming in telling you they're going to fix, quote unquote, your problems. And so when you think about having high conflict and trying to address things, our team really does a wonderful job of trying to understand the family, but not only trying to understand them or what's going on, but trying to understand them on their terms. So you're not just taking the referral and saying, well, this is what, was reported to us. And so we're coming in here and we're going to fix this, and that, but letting the family speak to their strengths. So I'm letting the family speak to some of their challenges and really, again, as I stated earlier, giving them the tools to address their specific needs at that time.
The goal of FFT, like you stated, is to help them develop skills and tools that they maybe didn't have before. Can you just elaborate a little bit more on that, please?
Just trying to get them to have obtainable changes to help them function better. Having them have those same obtainable changes that will be able to be adapted in other domains of their life. So maybe the child is struggling with communication in the home, and then we realize that that's also a challenge in the community as you think about pro-social skills and having to interact with people in other domains of your life. So what does that look like in the community? What does that look like in school? And just being able to apply those and reach those other domains that may not be looked at when you just get a referral.
Give us, more of a sense of what it is FFT is doing in our communities.
Early intervention is always key. And so while we will absolutely love to work with families who have had high conflict and have had high system involvement for many years, there's really a need and I think a greater possibility for change and impact if we start early. And so think about referring to FFT when you're starting to see some of those risk factors come out or increase. And how can we get in there early, build those functional skills to promote stability before things really decline, before maybe that youth is now involved with the Department of Juvenile Justice.
If someone's watching this and they think perhaps maybe it would be a service that would be helpful to someone they work with or to their own family, where should they go for more information?
I'm your best contact for really staffing cases, exploring whether or not FFT might be the right fit, really talking about potential trainings and learning opportunities for your team as we're kind of spreading the word of FFT. I can be best reached by phone at 804-248-1059 or by email to really connect and see how we can better support your needs and your families and your community.